Welcome to The Difference. I'm Steve Castile, and today we have a visit with one of my favorite people, Ann McCullen. Stay tuned.
You are listening to The Difference, a presentation from The Hour, a 54-year ministry. Steve, first we started on radio, then went to television, then we went streaming online. So at Our Stream, you can watch our programming from all those years. So it's at thehour.org. And now, here we are. Steve, you and I both have gotten to know tons of wonderful people. We have family, friends. Gosh, we've served with just beautiful people. But when you say it's one of your favorite people, that's important. And tell us about Ann.
Well, it's funny. There's been ties from the distance. When I served at Pleasant Hill, she was in Olive Branch, in Wayne Webster's congregation. Yeah. They moved to Hattiesburg, and she has had a lot of life changes in her life. But one of the biggest was when she took over the directorship of Edward Street Mission. She was also a member at our church at Heritage. She had been church secretary, as she'll say in the podcast, at Court Street, and so lifelong United Methodist. And she has always had a passion to help, to do. She has been a jack of all trades, but what makes her one of my favorite people is she's one of the most thoughtful, kind, authentic. To deal with the pressures and stresses she deals with every day, you don't catch her without a sweet spirit. And so she's just a joy to be around. And as you listen, you'll sense that in the interview. Welcome to The Difference. This is Steve Castile, and today I'm sitting with one of my heroes in the world. Ann McCullen has been just a shining light in the nonprofit world, especially in the Hattiesburg area. What Edward Street has grown into is, I would say, nothing short of legendary. It really is. It's an integral part of that community. But more than that, she's just one of the sweetest, most thoughtful, faithful people I've known. So, Ann, thank you for being a part of this podcast.
You are so welcome. It's my joy to be here.
Yeah, and I know. And if y'all could see her smile and just know that's her temperament most of the time. And the joy that she has in serving is incredible. One of our purposes at The Difference is to tell the stories of the folks that are different, that are making a difference. And you're absolutely one of those. Did you ever think early on that you would end up as executive director of one of the most incredible ministries I've ever seen?
I really didn't know what I was going to do in life. When I was in high school, I think I was like 10th grade, 11th grade, our school counselor had all the students in our grade do one of those skills tests or, what should you be when you grow up?
Exactly.
And my friends were so excited because it said, you should be a computer programmer. My friend who got that did it, excelled at it. You should be a doctor. You should be an air traffic controller. And it was a grid with little points on it. My dot was in the exact center of the grid that said, you're going to be happy with anything you do.
Wow.
And I was like, no, give me direction. Tell me what to do in life. And so after college, I'm general business major. That summarized my life. General. It's general. It's generally this and generally that. And I used to beg my dad, what should I do? And he said, listen, it's not my life. I'm not going to carry that on my back. So I floated around and did everything from being a bridal consultant to a hospital purchasing agent. I bought clothing and would go to New York once a month, everything in the world. Then I fell into being a church secretary at Court Street United Methodist Church in downtown Hattiesburg. I started there in 2000. And the church was really figuring out, I think the pastors, Connie and Joey Shelton, pretty much they were told, you're either going to make this church work or you're going to be the ones putting the lock on the door.
Right. It was in a transitional community. A lot of things were going on downtown in Hattiesburg.
Yes, and a really big building. It had been used back when there were two conferences. There was the North Mississippi Conference and the Mississippi Conference. Annual conference for the Mississippi Conference would be held there. The sanctuary was large enough. And it had really, like you said, transitional area. So Joey met with the members who were there and said, are you willing to open this church up to our neighborhood? And they embraced it.
Mm-hmm.
They went around and invited, knocked on doors, picked kids up, and even without their parents, you don't do that anymore because it's a sanctuary,
Exactly.
but they would pick them up, bring them into the church, and the church became the most beautiful thing. It's what the church should look like. It was the worship home for the Ark, so for adults and kids with disabilities. There were people wearing their pajama pants to church and ladies literally in their mink coats, and they were a family. And that wasn't my worship home, but I worked there for 10 years. And then I went to my church and did children's ministry, and I just missed that peace. I missed that feel of, this is what my community looks like. My community is very diverse on every possible level. And by that time, I was on the board of directors for Edward Street Fellowship Center, which had been around for a minute. It was founded in 1979 as a ministry of the Hattiesburg District.
And much of the time operating out of the old church there with a basement kind of facility.
That floods still.
Exactly.
Yes. And it had grown some and morphed a little bit into different things, but basically it was like after school tutoring. There was a little child care center that had actually moved into Court Street where I worked, which is how I think I got on the board. After I left there, I kind of knew some of the board members from that. But the executive director at the time was Molly Vickery, and Molly was a deaconess in the UMC and went to work for what is now United Women in Faith in New York, or as we say down here, in New York City. New York City, yeah. And so Molly and I spent 2 hours transitioning on a Memorial Day. It was like, okay, we'll go over it. And I just, ever since then, I've been there 12 years now.
Oh, wow.
And even on the hard days, and there's any ministry, any facet of life has hard days, but the hard days are just as worth it, and sometimes more worth it at the end of the day. It's just a good place.
It is an incredible place. I mean, I think while Molly was there, they had built the beginnings of the new shell for the food pantry, and it was, at that time, everybody was just fascinated by the growth. It was just such an addition. And now, I mean, I'm just blown away every time I walk on site to see what it's grown into, because now you have medical facilities that are just, y'all worked and got transportation set up where there's a bus stop literally right there. It's just remarkable. Talk about that transition and how it happened.
Well, I think actually having a business background gave me a different lens when I walked in. So when I walked in, I really looked at infrastructure, which isn't very churchy sounded, but and it was not casting shade on anybody who was there previously, but the building that the food pantry's in, which was fairly new when I got there, I think it's 4,800 square feet,
Yes.
and there wasn't even a phone system. You remember those old portable phones and you'd put it in a charging base? Yeah. They had that for a 4,800 square foot building, only one line. You couldn't even put anybody on hold. So the caller would hear you saying, Eddie, anybody seen Eddie? He's in the bathroom. So, we did a few things like that. There wasn't a sign out on the street. Just, really some infrastructure things. So we did that. But then the big shift, the food pantry was serving, which is still a sadly huge number. But when I got there, we were serving about 800 households every month, which is staggering. And the numbers they climbed, as the years went by, and we were over 1,000, and then we were at 1,200. But we had a program director who is still such a dear friend. We get together once a week. Lori Herring, she's not on our staff anymore, but she and I looked at each other and said, we know Jesus says the poor will always be with you. There will always be a need for a food pantry. But what are we doing to actually help people not need a food pantry? Right. The big programming that went on at Edward Street, which was fabulous. It was a girls' club, after school once a week, and a Cub Scout troop and a couple of Boy Scout troops. So there was great stuff going on. They had stopped the after school tutoring before I got there. But it was those services, those programs were happening elsewhere in Hattiesburg. And one thing that was not in Hattiesburg's called the Hub City because you can, in an hour and a half, you can get to anywhere. You can get to Mobile, New Orleans, the Gulf Coast, Jackson. It's right in the middle. And it is a medical hub as well. But from what all the old timers tell us, there has never, ever been a free clinic in Hattiesburg. There is a fabulous federally qualified health center, a sliding scale clinic that's great, but you have to pay something to go. Right. And there is not a huge population, but there is a large enough group of individuals who cannot afford that fee. So Lori Herring, that program director, and I said, maybe it's healthcare. Maybe if we could get people healthy enough, then they would be able to get a job with insurance. They would be able to get a better job because they would feel better. So that conversation started in 2014 and grew into the clinic, which you're right, it has grown exponentially over the years, not necessarily in numbers, but in depth of services.
Well, and what I love about Edward Street is it is just an absolute quilt of connections and collaborations within the medical community, within the faith-based community. It's just remarkable of how you have kind of put that puzzle together with so many pieces, and it looks whole.
It is, and that's all God.
Yeah.
Every bit of it is God. When we started the conversation on should we do this health initiative, what was it going to look like? The conference was actually holding an event at Camp Wesley Pines, and Bishop Swanson was there, and some people from some of the big boards of Methodism came down from DC, and they were talking to several people. If you had any interest in starting something health related in the conference, you could go. And people at that time were really into HEC, HEC, Health Education Community, under the premise that for a lot of people, I'm in that age category now. We get older, and you aren't going to tell me what to do. And they may not trust their healthcare provider. They may have white coat syndrome. They just don't know who these young whippersnappers are. And especially if they've moved in, if you're in a more rural area and it's not somebody from there, you just don't trust them. So they were not being compliant. They may know they have diabetes or hypertension or any number of things. You can give them the pills all day or the special diet, but they're not going to adhere to it because they don't know you. Right. But there is a trust level within the faith community. And so they were trying to get churches involved, teach your lay people how to take blood pressure. Put a ban on fried chicken at the church potluck. That's sacrilegious, I think, to say that in Mississippi.
You just sent ripples through
Talk about some controversy. But, engage the faith communities. And so having some conversations with those guys one-on-one in between the main meetings, they instilled in all of us and in me to have this boldness to believe that God can do what we can't. And one of the nuggets that I took away, and I think it applies to anything that you're trying to do in life. If you have a dream and you have a vision that God has laid on your heart, and it's God's vision, it's not yours, you're just the tool being used. Don't go to, you need some help with this. Don't go to the lowest person on the totem pole. Don't go to that person you kind of know from your neighborhood or from your kid's soccer team. If you can, go to the decision maker of the organization that you're trying to work with, because that lower person on the totem pole has dreams of their own within that organization.
Right.
And they may not burn their favor with the top dog for you.
Right.
And nobody can share your vision like you can. So I pulled over as soon as I got to where I had a signal somewhere between Gallman, Mississippi and Hattiesburg. I pulled over and I started calling people that I didn't know. And they were big name people in the faith, the education, and the healthcare community and the business community of Hattiesburg. And I said, hey, if we had a gathering to talk about a free clinic in Hattiesburg, could you come? And so we started that conversation with those people. But before then, we did all of our work. We surveyed people who were coming in our food pantry and said, when's the last time you saw a doctor? Where did you go? Do you know that you have any kind of chronic condition? And we were stunned. Most of the people that we talked to in our food pantry said they had not seen a doctor in over 10 years.
Wow.
They had gone to the emergency room because our big hospital, they have to treat you even if you can't pay them, even if you haven't paid them the last 10 times you've been there. And they knew what they had. And we had a little checklist for our survey askers. At Edward Street, we never hand anybody an application. That way, if you can't read or you can't read well or you can't read English, you're not embarrassed, because everybody is being asked the questions. So we had volunteers asking the questions. But we had all the things like, do you have high blood pressure? Do you have high cholesterol? Do you have diabetes? What we weren't prepared for under the other category was schizophrenia, bipolar. We had not considered all the mental health. And that can hold a family back as much as any other thing that can be treated in an emergency room. And there is a stigma to it, and it's harder to access that. The hospital doesn't know what to do with you all the time if you're having a schizophrenic episode.
Nor does most of the rest of the community.
Right. And so that's just how her husband is, or that's how their daughter is. And it's left untreated, but it holds the whole family back. So through all of that, that was all in 2014. We started visiting other free healthcare facilities around Mississippi and started offering services by February 15.
Wow.
One of our first really valuable partners, there is a legend in the Catholic world in Hattiesburg, Father Tommy Conway.
Oh, look at.
He came to our initial meeting, our interest meeting of the faith and community and business and healthcare leaders, and they said, hey, we're thrilled that you've done these surveys, but we don't even need to see them, because this was on the cusp of Obamacare, as it was called back then, the Affordable Care Act. And we said, is this a moot point? And they said, nope. We've already identified that there is a segment that is not going to be treated. And it's the young working class folks that can't, they work, but they don't make enough. It's the guys and the girls with the GED or not.
Hourly wage.
And it's seasonal. If you clean a hotel room, if there wasn't a Little League ball game tournament this weekend, that hotel may have sat empty all week. They're not going to pay you to clean the room when nobody was in it. So you're seasonal now. If you're a home health sitter and your person goes into the hospital or they pass away, you're unassigned until that agency gets another client that needs your services. So there is a population of the working poor. But anyway, Father Tommy said, "Oh, we will meet every other week." And we had used Parkway Heights United Methodist Church Fellowship Hall. He said, "But not here.
I
Not
can
here."
hear his Irish brogue right now.
He said, "We will meet at your place." And I'm looking at lawyers and the CEO of Hattiesburg Clinic and all these people. And I said, "You're going to come to our hood?" And they were like, "Yeah, I mean, we need to see it and talk about it." And so we made an agreement. 90 minutes. If we're not through, we're ending the meeting and we'll see you in 2 weeks. That was in October of 14. By February of 15, we started doing dental referrals for extractions and cleanings. And by March, we were working with a connection Father Tommy made, St. Vincent de Paul Community Pharmacy out of Biloxi, Mississippi. It is a huge ministry of the Biloxi Diocese of the Catholic Church. They've just expanded into Jackson in the last month or so.
Really?
Yes. So they've worked with St. Dominic's, apparently, I haven't seen the facility, but the photographs, it looks incredible. They do the most fabulous work, but that basement that floods, we have a sump pump in our old church building, and that's now a fully licensed closed door pharmacy that we let them use rent free. We pay the rent, the property insurance, all of that, because we're thrilled to have them, and they provide medical, prescription medication for a lot of our patients at our free clinic.
Well, and you talked about other partners. In the health community, there's such a crazy thing now with insurance, and now a lot of the hospitals are getting out of the mental health business. They're battling the whole idea that you talked about of the emergency room being used as a general doctor or a main healthcare system. And so talk a little bit about, for Forest General, for example, this also became kind of a gift for them where it's a win-win.
It is. It is. Forest General never gave us the dollar amount. Their former CEO, Bill Oliver, was on our committee as well. And so he and Tommy Thornton were such a resource, Hattiesburg Clinic and Forest General, the two huge players in Hattiesburg. They never gave us the dollar amount of how much Forest General writes off per year on all the visits that they are not reimbursed for, either through self-pay or insurance or Medicaid or Medicare. But I have no doubt it's significant. And they were just starting a family medicine residency program through those two facilities, through Hattiesburg Clinic and Forest General, about this same time. It was a total win because they needed more places for the residents to practice. We needed doctors on a regular basis. And it was, if we could keep people out of the ER, if you know you have diabetes, but you can't afford the insulin and you can't afford all the little lancets and testing strips to know what your A1C is, to check that blood sugar level, you're just going to land in the ER on the regular.
Exactly.
Either in a diabetic coma or really close to it. And that's going to be, you can't pay them a dime. You can't pay for the ambulance ride. You can't pay for any of the ER care or the ICU care or the regular room care. They're going to give you 1 month's worth of medication and send you home, and then the whole cycle is going to start all over again until you are having your extremities amputated later. Right. It's just a horrible cycle. So they were very interested in what we were doing and gifted us down the road with the electronic medical record system that is in Forest General and Hattiesburg Clinic. So now Forest General takes care of all the hardware, the fiber optic cables, all of that. Hattiesburg Clinic had to write all new software programs for us because we don't have any billing codes.
Yeah.
And we're unusual in that in one clinic, we need all the information. We need to capture the information when you see the doctor. You have lab work, you have physical therapy, mental health counseling, pulmonary care. If we've referred you to a dentist, your prescription referrals, all of that. And that's unusual. We also do chronic condition education. That is a partnership with USM's School of Nursing. The physical therapy is through William Carey's Department of Physical Therapy. So we're an academic rotation, and I wish for our brothers and sisters all across Mississippi, all across the rural South, that they were in a hub like we are. We
Right.
realize what a gift it is.
I mean, that nursing school is just incredible. The whole social work, I mean, that you have almost every resource that you'd ever like to draw upon. William Carey's extraordinary reputation in pre-med. I mean, just a cornucopia of
It is.
resources.
It is. In August, we're going to start having dietetic interns from USM, and those are grad students, and we'll have them for 22 months to do more in-depth counseling with our patients. But it's a great thing. It's a win for the whole community. United Way is a fabulous partner for us. The very first grant we got, which gave us a big pump up, was from the Mississippi Conference of the UMC, and since then, we have had lots of churches walk alongside us and volunteer physicians and nurses and social workers and pharmacists and dentists, all the people who come in and make it happen. And to a person, they say, the patients here are so nice. And I'm like, man, you're not charging them. Of course not.
Exactly.
But no, really, they are so very, very appreciative and so compliant. We have a higher rate of patients who show up for their appointments than any of our physicians have in their private clinics.
Well, I mean, the thing that I think about is you talked about early on, they did Cub Scouts, Boy Scouts. What Edward Street has almost always had is this incredible community trust, that this is a safe place, that the people that are there really care about us. And you've done such an incredible job of keeping that integrity while expanding the services. And all of Hattiesburg knows Edward Street. And from the soup bowls to just churches being able to come out and visit, youth groups volunteering, it's just such the perfect snapshot of what something can become when you just totally give it over to God.
That's so true. We are blown away all the time at how hungry and thirsty people in the community are to make a difference. They just need to know what to do.
I get it
So,
famous somewhere.
right. And so our thrift store, which started in 2012, is a huge way that people plug in, and lots and lots of ministries. In Hattiesburg, everybody from the animal shelter to, gosh, I can't even remember who else. The Soup Kitchen has a thrift store. We have one. They're all over town with different ministries, and they're all great. We are so pleased that our thrift store, in addition to making money so we can buy food for the food pantry and medical supplies for the free clinic, but it is so much its own ministry. The thrift store manager is a pastor's wife, and she says, my husband has his ministry. This is my ministry. So if any social service agency, caseworker, any kind of representative from a vetted agency contacts us, whatever they need is free. And today I talked to somebody from Butte, Mississippi United to End Homelessness. She was rehoming a family of 4, mom, dad, and 2 small children. She said, I got mattresses for them, but that's all. And I said, hey, go hit the thrift store up. Whatever you need, we're happy to help with. And we do that for Child Protective Services. We even do it for the state hospital, the psychiatric hospital. We don't think about when somebody goes in the middle of the night, depending on their support system or lack thereof, the clothes on their back may be all they have. So we're happy to help however we can. But then we also hire a lot of folks, and we have several special needs individuals who work for us, and they're just as sweet as can be. Their families, it's a true blessing for the families, because when kids turn 21 years old in the state of Mississippi, they're out of the special ed program in the public schools. If the family members work, do they quit their job now? What do you do with this child if you can't afford some kind of day program. So that's not what we are, that's not our main focus, but we do have some individuals that it's really important to the families as well as to us and to the employees that they're getting out of the house and giving back a little bit. But it kind of all ties together in so many ways. I had a friend from my church who texted me and said, "Hey, don't y'all do some kind of mental health thing?" And one of her coworkers in the school system is a licensed professional counselor. And she said God had been nudging her to give back. And she wanted to help us. And I said, well, actually, all of our mental health stuff is telecounseling. The counselors are at home or in their office, but they're doing it on their own time. And so to protect them, they would need somebody else in the office, and they don't want to have to pay somebody to sit with them when they're doing free counseling. So we do tele. Our folks usually don't have any kind of tele capability. They don't have smartphones or internet or computers. So they come to our clinic and we put them in an exam room at one of our computers, and the counselor is in his or her office. So this counselor said, "Hey, that's right up my alley. That fits my schedule. I can do this after school. This is perfect." And she said, "The reason I'm excited is because I worked for Child Protective Services for 16 years. And every time I needed something, I knew that your thrift store would handle it. No questions asked. I said, I need this for my kids. I need this for the people I'm helping." And it was ours. And she said, "And I've wanted to give back to you ever since."
Wow.
And that's giving back to God. And she was giving God all the glory too.
That's the economy of God's kingdom. I'm reading a book right now that I've just told everybody about called The Soul of Money. And that the person who did it's founded an international nonprofit for hunger, India and several different places. And her premise is generosity is like water, and that money is given to us as a tool. Our gifts are given to us as a gift, and that if we don't give them away, then we lose the value. And Edward Street's the perfect example of this beautiful kind of living organic flow of generosity and thoughtfulness and need kind of coming in together in one intersection at a place that is truly one of the coolest places I've ever been. As we close out, I want to ask you, we try to come alongside organizations like Edward Street. How can people help? Those that are geographically close, I mean, there's lots of things, but those who are listeners that may be interested, where can they find out about you, and what can they do?
Our website, we think, is pretty user-friendly. It's Edwards with an S, edwardsstreetfellowship.org. And it'll walk you through all the different programs and the how to get involved. If you want to give financially, you can do that. If you're in our area, we can send you a list of ways that you can support us through food drives, decorating the grocery bags. We give out 4,000 grocery bags a month at the food pantry, Steve.
Wow.
So we're now, when I got there, we were 800 families a month. We're now consistently over 2,000 per month. That's more than 6,000 individuals every month. And it's sobering. We give God the glory that we always have food on the shelf, always. And it's the balance that we want. We have a formula. It's not haphazard, but we would love all 4,000 grocery bags to have scripture, encouraging messages, have the kids, do a sunshine and a smiley face on the bags. But there's so many ways that you can support. But if you are in a different area and you want to do something at your church for your area, reach out to us through that website. We will send you ideas. Our dream is that anything we do is replicated all over the place, because there are folks everywhere that need help, and sometimes we can become blind to it. We don't mean to be, but it's that neighborhood, it's that part of town, it's that family.
Well, and the other thing is it's just overwhelming. Where do I get a toehold?
Yeah.
And your story just told this didn't happen overnight. This wasn't all roses and success. It was this journey, and as it grew organically as people responded to God's call and God's giftedness. So if we got somebody who's listening who feels that call, like your friend's friend who brought her counseling skills, where do they start?
Pray. Look at your gifts, because I think part of the reason that we morphed into some different areas when I arrived is because I didn't have tons of experience in, I did led my daughter's Girl Scout troop, and I did Bible school and everything at church, but I didn't have an education background. So my wheelhouse was business, and I had been a hospital buyer and had some experience in retail. And so these were areas where we went were things that God laid on my heart, but had prepared me my entire life for. And all those disjointed jobs actually were all pointing to this one place. But when the day comes that I'm not at Edward Street, the next person's going to have a different skill set.
Right.
And I have total faith that entire ministry will just continue to kind of, meander into new areas, and it'll be something that the people who are running the show at that time, under God's direction, God's running the show, but those people, it'll be their gifts and the things that they're used to.
And God, the prevenient grace of God knows the things that are needed that will come. He will have the people with the tools to meet those needs.
Yes, and He's preparing them today. He's preparing that college kid today for what they're going to be doing down the road to serve Him.
Well, I want to close by saying, first of all, what I admire about your leadership is just what you said. You know your wheelhouse. You surround yourself with people who meet the other needs, who have a diversity of gifts, and you let them do their thing. And it brings you the joy of watching that, and it brings them the security of having a leader who knows that they're trusted. So I appreciate that spirit. And I want to say to those that are listening to the podcast, if you've never been to Edward Street, if you're in a Sunday school class or a women's group, or you just feel a call to frontline, even if you don't do it, to go there, there are certain places I consider sacred that are not sanctuaries. There are places where the Holy Spirit just speaks to you because of what you see and experience, and Edward Street's one of those places. And so we'd love for you to come see them. Call first, let them know. But see what God does when we make ourselves available. Well, Ann, I appreciate you joining us. You are such a blessing. You know how much I admire and respect you, and just am so thankful that you were obedient to God's call. And I just can't wait to hear what the next new thing is.
Thank you. Thanks so much for having me and letting me share a little bit about our story.
Well, our honor. Thanks for listening today. And as always, live loved. Well, what'd you think? Doesn't she even sound sweet in the interview?
She does, and talking to you can be,
challenging.
It can be a challenge, and she just sounded as sweet as she could be. So I'm impressed. She's won me over.
Well, one of the things we didn't say in the interview is when I was at Petal, and we were very involved in the community, and we got involved with Edward Street when it was just in the church, and my sister-in-law was a temporary director there, and in a really tough, struggling time. And so we had always loved Edward Street, and what Ann did there was just absolutely incredible. And if you go to Hattiesburg today and you say Edward Street, there'll be very few people who don't know who they are or what they do.
And respect.
And respect to the professional community, those who are being helped. And she has just become a beacon and a standard of how to do caring for other people well.
And I believe that's the group that I did some video helping
we
with one
went
time.
When they opened, if you'll remember, we videoed the new food pantry.
And even then, I was so impressed with what they were doing.
Yeah, and that was right before she took over. They had just done the new building, and she says in the interview that she ended up, the director then got the call to go work for the General Church in the United Methodist Church, and she moved into the leadership position and took that new building and just let it be the cornerstone of everything they're doing. It's just remarkable.
It is remarkable to see how a faithful person, and there are a lot of people plugging in at Edward Street, but the leadership of a faithful person being able to just affect really tremendous change. You see a lot of buildings, a lot of opportunities, a lot of things squandered or not led in the right way. Seeing someone come along with that heart and being able to do what she's been able to gather folks to do, that is a beautiful thing. And I just, again, the encounters that we have with meeting people who are difference makers, who are different, it is so inspiring to me.
Well, that's the thing that I've loved most of my life. I was blessed to have parents who were difference makers. I was blessed to have pastors who were difference makers. And I've just, through my work with social work and the church, there's not been any appointment I've ever gone to where there wasn't somebody there who had heard God's call and were different. And so it's just, like you say, it's a delight to be able to just spend time with those folks.
And sometimes it is a remnant. Sometimes, sometimes
exactly.
you have to look to find that person. But people like Ann and what she's doing put a lot of fuel in the tank for you, because you can be around and be filled up with a conversation like that, and then that spurs you to want to go and do and be better.
Right. Well, as we close, I do want to say one of the joys of doing those podcasts at annual conference was also they have
to see them stand.
Have a display area where they have most of the other institutions that the conference partners with. And we're going to have some future podcasts. One of them is going to be with the Methodist Children's Home, which we have a long history with. And they're doing some incredible things there and about to have an anniversary themselves. And then also, I met up with some friends that I had not seen, I guess, in 2 years. Goyo and Luce were the missionaries that came into Trinity Mission Center in Forest after we started it. And so they're now in a mission church up in Memphis doing a Hispanic ministry up there that's absolutely incredible. So God is always leading us back into places where we can find new people to have conversations with.
That's great. It's all about connection.
It is. It is. Well, we thank you for joining us today. And as always, hey, remember, live loved.
You've been listening to The Difference, a presentation of The Hour. The Difference is made in conjunction with and partnership with the Institute for Southern Storytelling at Mississippi College. To find out more about the Institute and ways that we are partnering and mentoring young lives through storytelling, filmmaking, and more, visit us at southernstorytelling.mc.edu. And for more resources from The Hour and from The Difference, check us out at our Hour Stream platform with the streaming content at thehour.org. I'm Anthony Thaxton. Thanks for joining.